Well, they do say your smile is your best advertisement, but 30% of Australians avoid the dentist. One of the prime reasons, because of cost. And for those who've lost teeth due to an accident, disease, neglect, a smile really can be a source of embarrassment. Now, in the past, a lot of people with missing teeth have had to put up with uncomfortable dentures, but now dental implants seem to be the way to go. This morning, we're joined by Dr. Sandra Short and two of her patients, David and Grace. Morning, one and all.
Morning.
Morning. OK, we're talking this morning, Sandra, about dental implants. Exactly what is a dental implant?
A dental implant is a replacement of a tooth, and it's the root and the crown of the tooth. It's made out of titanium, so it's a man-made tooth. It's placed into the bone, and what happens is the bone fuses around it and it integrates, so it becomes exactly like your own tooth.
So under what circumstances would you have a tooth implant, because it is the root as well?
Yes. Under the circumstance where the root has failed.
Now, so it's only if the root has died?
Yes. Well, more than died. People say the root's died when they refer to the nerve dying. Any tooth that's been root-filled hasn't got a vital nerve, so it's a dead tooth. We try to preserve those teeth. There are some people who think they should be all removed, but in actual fact, if they're sealed and done properly, they can last a long time. However, there are cases where that doesn't work, it fails, or the whole tooth is simply knocked out completely, or periodontal disease destroys the bone that supports the tooth, and the tooth is completely lost.
OK. So if the root's dead, tooth is completely lost, that's where a dental implant.
That's right.
Now, Grace, I know your particular story.
Yeah.
What happened to you? Because you've had dental implants.
Yeah. When I was 6, my baby tooth was about to come out, but my auntie decided to move the process a little bit forward. So she just wrapped it around a piece of string and yanked it. And many years later, my tooth just never grew down. We never knew why. And I finally went and saw a dentist, and he discovered that the tooth was there, but the root was at a 90-degree angle, so it actually never came down. So I was toothless for quite a while there.
Wow. And then you went and had the dental implant, and we saw the before and after photographs there.
Well, there was a long period where I just had a denture and just kept that going for a while. And I had always thought about doing an implant, but I was just too scared to. And then I met Dr. Short last year, and that's where it all started.
Because the denture is the other way to go with this. And we know, people have been living with dentures for years, but the tooth implant is clearly a much better way to go.
It is. And there is another alternative, by the way, Kerrie Anne. You can have a bridge, which is a fixed bridge. Is the teeth on either side are crowned and the missing tooth is joined. So 3 teeth are joined together. The disadvantage about that is if you've got good teeth on either side of the missing tooth, you're destroying them somewhat to cut them down to put the crowns on them. So I'd prefer not to do that.
David, you're about to undergo this procedure.
Yes, tomorrow morning, 8 o'clock.
So, how do you feel about, what do you know? And what happened to your teeth?
Oh, I slipped in a bear enclosure in a moat. And
you did work there, we just like to.
Yeah,
you just weren't wandering into the bear enclosure.
Yeah, and I slipped in the moat, and the force of the fall ruptured 3 discs of my lower back, 1 of my thoracic, and 2 on my neck. And from the fall, I bit my mouth that hard that killed the nerves in my teeth.
Wow.
And I end up getting internal resorption, which the teeth die from the inside out.
Is that common?
It is quite common, actually, in trauma cases, yes. If that was treated initially, at the time of the injury, if the nerves were taken out, it may not have occurred. But since it wasn't treated initially, because David didn't have any pain or wasn't aware of that pain.
We had so much other pain, obviously, that was masked then.
That's right.
OK. So, in all cases, really is better to try and save the tooth, doing a root canal than a crown, which is you carve down the tooth and replace it by another man-made crown, and it should look like a normal tooth.
Yes.
But if all else fails and you've got no root, the tooth implant compared to a denture or a bridge is superior. But at the end of the, I know you suffered for many years. How many years did you were toothless, and then with a...
I think I was toothless probably for about a year or 2, but that was my teenage years, whereas, your image is really important.
Horrible.
And then a denture for maybe 20 years or so.
And how many teeth are you having implanted, David?
2.
2.
2 front ones.
Cost always comes into this. It's not an inexpensive procedure.
No, it's not inexpensive. but it's a discretionary expense. And these days...
So what sort of money are we looking at?
Well, for a single tooth, you're looking at around about $6,000 approximately. I mean, it varies. It depends on if there's work having to be done on the bone. Sometimes we have to do bone grafting or soft tissue grafting. So it can vary, but around about $6,000.
Because crowns are anywhere between $500 and $1,000 on average.
Well, actually, even up to $2,000.
So it does vary. But clearly, if you want to avoid having dentures and these other procedures, that's the way to
Definitely,
go.
that's the way to go, yes.
Okay. It's something I've got to say I've not heard of the tooth implant before, or a lot of the other procedures. So it's good to know that clearly technology is catching up. And we look at these photographs here and see what can be achieved. And one on the left certainly isn't pretty. Again, on the left isn't pretty. So it looks like a fabulous result. And again, are these all teeth implants?
Each one of these patients had implants. The initial one that we saw has a denture. So the implants are supporting a denture, which is a cheaper option than doing an implant supporting bridge work or crowns.
Gotcha. But again, to do the whole mouth is an expensive exercise, but it's good to look at all alternatives.
Yes.
David, Grace, thank you very much. Chukas for you. Sure, it'll all work out well. And Sandra, thank you very much.
Thank you very much.
We've got more details for you if you'd like it on the website kerrieanne.com.au.